All right, it is Breast Cancer Awareness Month, and joining me once more, we've got Dr. Heather Bracey, diagnostic radiologist. We've been talking about screening with her this morning already. Now we're going to talk about what you should know before getting a mammogram. So you're getting ready to go in for your appointment. What should you know all about it, Doctor?
We want women to know a few things. One is that your technologist is not here to hurt you. They want you to come back year after year. They want you to feel comfortable when they come in the door. When you come in the door, please talk to them. If you are uncomfortable, seriously hurting when you're getting your mammogram, talk to your technologist. I hear women come in and go, "It was horrible." Like, "Why didn't you tell us?" I mean, if you tell us, we will back off that compression a little bit. Okay, so that's number one. Number two, wear a two-piece outfit. Don't come in here with your dress on because you're gonna have to take it all off. Obviously, from the waist up is gonna be naked, so you know, don't wear wear some pants when you come in the door. The third thing is, if you are a woman with sensitive breasts, a lot of us have pain, especially around our cycles. Try to schedule your mammogram for the week after your period. It really helps with the breast, with the tenderness, along with the mammogram. Remember, you're only in compression for about 10 seconds at a time. It is not a long procedure. And, you know, basically, bottom line is just talk to us.
Yeah, and you know, you hear from folks, you know, they say, "Oh yeah, the mammogram, so it's really painful." They just kind of expect that pain. That might be why they're not even asking to do anything about it.
I don't want you to expect pain. I want you to come in here. Like I said, we want you to come back every year. So please talk to us. We're not here to torture you.
Okay, well, there you go, folks. Again, Dr. Heather Bracey, diagnostic radiologist. We have been talking this morning over here at Willis, Knighton Health Breast Health Center. Breast Cancer Awareness Month is what it is today. First Cup with First News. This morning, Breast Cancer Awareness Month is what the theme is. We're over here at Willis Knighton Health Breast Health Center talking more about breast cancer. And joining us right now, again, we had her just a little bit ago at 4:45, is Dr. Julie Cupp. She is a breast surgical oncologist. And Dr. Cupp, welcome again.
Thank you.
Got another question for you here. Okay, earlier we were talking about self-exams. Now we're going to talk about mastectomies and when are they indicated?
So for mastectomies, the indications for that is when we have a tumor that is too big to allow for breast conservation or in the avoidance of radiation. So we've known since the 70s that really and truly mastectomies does not offer a better survival compared to breast conservation. So as long as the tumor is small enough to have a normal looking breast afterwards and you're willing to do radiation, breast conservation is
Lots to talk about this early in the morning.
It is. So breast conservation is a great strategy for many women, but if we do have really large tumors or the hope is to avoid radiation, mastectomy is the way to go.
When they are larger, is that a result of waiting too long for an exam, or is that just an aggressive form of cancer?
Can be both, you know. So yes, delayed in surveillance can catch things later, but then also some tumors are just more aggressive and will happen bigger, and then some are sometimes harder to find, and so we don't see them until they get bigger.
Okay, all right. Thank you very much, Dr.
No
Cupp.
problem.
We appreciate it. We're going to have more coming up here in just a little bit. First Cup with First News. Willis Knighton Health Breast Health Center Breast Cancer Awareness Month. We're in October. It is October 3rd. We've been talking all things breast health this morning. And joining us to talk a little bit more about that, we've got Dr. Heather Bracey. She's a diagnostic radiologist. And Dr. Bracey, welcome again. We had you in here last year too. So we appreciate you coming in early this morning. All right, so we're talking about screening. And we're going to ask about, I guess, the who, the when, and the why for the screenings, and I'll let you take it from there.
Absolutely. We want women to know that beginning now at about the age of 30, you should be meeting with your doctor and figuring out what your risk status is. If you're an average risk woman, don't have a strong family history, then generally speaking, you can start screening at age 40. Absolutely recommend it yearly, every single year. When you talk about breast cancer, the fastest growing cancers double in size over about a 4-month period. If you're going 2 or 3 years between your mammograms and you've got a cancer, it can get really big. So we need you coming in every year so that we can see when things change and we can find it early.
And if you're genetic, I mean, if you have it in your family already, you definitely need to come in a little bit more often too.
Well, if you have it in your family, then we do kind of do a little bit of a different type of screening. We'll do annual mammography, but sometimes we will supplement with MRI and other things so that we are trying to catch it as early as possible if it should ever happen.
Okay, so screening, again, you do that how often?
Every year, starting at 40.
Every year, starting at 40. All right, and Doctor, we'll have more from you coming up in just a little bit. Dr. Heather Bracey, diagnostic radiologist, Willis Knighton Health Breast Health Center is where we are for First Cup this morning.